Because of the drop in methamphetamine prices, the trade for black market and illegal marijuana has become a pretty significant threat to the Rogue Valley. We're seeing people bring large quantities of methamphetamine to our valley and then trade them for the readily available black market marijuana.
And so the whole idea of this is so that you can find outbreaks, any increases in certain communicable diseases, injuries, and conditions so that public health can respond.
At this month's local Public Safety Coordinating Council meeting, we heard from Sergeant Ben Lytle of the Medford Police Department and Health Promotion Manager Tanya Phillips from Jackson County Public Health. They spoke on the two sides of the national response to drug problems in our communities, supply and demand. Here are the highlights from November's meeting.
MADGE was formed in 2009 under the HIDA program, and that really expanded our capabilities and allowed for some different funding methods. But more than anything, it formed very strong partnerships. Whereas there had been drug task forces working in the valley for a number of years, this really brought everybody together. We're one of 15 Oregon, Idaho HIDA areas that are designated as a HIDA team. It opens a lot of doors. I can call a HIDA team, and there's sort of an understanding and agreement that we're all going to partner with a lot less red tape or bureaucracy that might otherwise exist, and it just opens the doors. The stats is just a comparison on a couple of the categories that we measure our success by. You can see that time passes, we're just getting busier and busier. Year to date, 2019, we've had a really stellar year. And there's some interesting things that caused this. You know, the methamphetamine stat is increased. We've seized about 51 pounds of methamphetamine this year. Yes, it's more prolific. It's also less expensive than it ever has been. When I was a new cop and commercial meth was kind of a thing in the late 90s, it would run between $18,000 and $20,000 a pound. Now in our cases, we're seeing methamphetamine in the Rogue Valley from the Central Valley in California at about $1,800 a pound. So it really is a flooded market. And because of the drop in methamphetamine prices, the trade for black market and illegal marijuana has become a pretty significant threat to the Rogue Valley. We're seeing people bring large quantities of methamphetamine to our valley and then trade them for the readily available black market marijuana. And there's the lack of disparity in price has really made that sort of a common practice right now.
So hello, my name is Tanya Phillips. I am the Health Promotion Manager for Jackson County Public Health, and Eric invited me today to really talk to you guys about our heroin and fentanyl surveillance and alerting system that we've developed at Jackson County Public Health along with our partners in Jackson County. So really we began working on this in 2018 in direct response to what Medford Police Department was reporting on, that we had a cluster of 10 fatalities. And then there was suspect that in questioning, is this heroin, is this fentanyl? So there was a lot of questions that were happening with this. We began having a discussion of, you know, what data is available for local health departments to really begin monitoring. What is it that we can do so that we can identify any spikes or clusters that are happening in our community, but also identify what may be the cause, with the hope that we can detect something early on so that we can then respond earlier on, preventing, you know, really non-fatal and fatal overdoses in the situation. Through the discussion, we realized, yes, data is available. So for us, this is really around EMS, our hospital systems, law enforcement, and then our medical examiner. In working with Oregon Health Authority, a lot of this data is available to local public health departments, but the issue was it wasn't in a timely fashion. That data could be made available to us on a quarterly basis or even an annual basis. So when you're looking at building a surveillance system and being able to identify these spikes and clusters early on, that wasn't going to work for us. And so it really was at that time that we realized whatever we were trying to build, it had to be at a community level. We needed all of our partners at the table. They needed to participate in the process, and we needed their support. We use a system called Essence. It's a syndromic surveillance system, and the name of it is really Electronic Surveillance System for Early Notification of Community-Based Epidemics. And so the whole idea of this is so that you can find outbreaks, any increases in certain communicable diseases, injuries, and conditions so that public health can respond. We currently have a system called ODMAP. This is basically another syndromic surveillance system that has GIS capabilities. I am a huge fan of this database here. It's developed by HIDA, and the whole point of them developing it was to support public safety and public health efforts, to mobilize and respond to increases and or spikes in overdoses. But all in all, when we look at the data and we work with our partners about what we're seeing, there's a part of this that has to be a gut check of like, yes, we are seeing an increase and we feel that it's for the better good of the community that we need to issue an alert. So we'll share with our partners what their data is telling us and what alert that we are recommending, and then they will say, yes, we agree with you, and give us some supplemental data about, we are definitely seeing something is happening. And then from that point, we'll just develop the communication at public health. Then we'll also develop talking points. So that's something that we've learned early on of, even if just public health issues a press release, media really like to go to Medford Police Department and the Sheriff's Office. So having those talking points have been really important. So we provide that to all of our agencies, and we also provide that information to our hospital PIOs, just because we are utilizing their data, even though we have access to it already. We are aware that the media could also come to them, and we want to really make sure that when we're talking about the overdoses, that we all have a unified voice, no matter who the media goes to, that we all have the same message. So lessons learned, this has to, at a local level with our lower numbers, this process has to be flexible. So as I mentioned, not having some difficulties developing a threshold, being able to look at data comprehensively, working with our partners and making a determination that issuing alert is for the greater good of our community, and having the flexibility to really do that. Another thing to mention, Jackson County Public Health, we do not receive any extra funds to do this work. We felt that it was very important, and we felt that we were the right entity to take the lead. I found a way to tie it into our preparedness grant, and Oregon Health Authority said that that was fine. So again, we don't have dedicated staff to this. It's myself, our epidemiology, and Dr. Jim Shames that are really making this work from local public health.